Hi, my name is Dr. Aston and I'm a doctor here at Core Medical Center. So the title of this video series is How to Avoid a Total Knee Replacement. So we're going to be doing several videos on the knee. This first video, we're going to focus on some of that basic anatomy of the knee, so that way you understand what we're talking about when we talk about these different conditions and these different treatment options that we can do to alleviate knee pain and actually help you avoid a total knee replacement. So first, let's go into the knee. So remember, I am a doctor, not an artist, so these drawings may, yeah, you can see for yourself. So basically, when you look at the knee, it's comprised of three bones: the femur, the tibia, and the fibula. Okay, so these are the bones that involved in the knee joint. We also have two types of cartilage. The first type of cartilage is spongy cartilage called the meniscus, and then we have hard cartilage, which is kind of like teeth, called articular cartilage. So what happens to a person when they start to develop osteoarthritis or they go through that degenerative process is they start to have damage to some of these structures. And the most common reason to have damage to some of these structures is from a malpositioning. And so we'll discuss what a malpositioning is. So this is another drawing of the knee, but this knee is not doing so good. As you can see, there's a lack of space on one side and there's a lot of space in the other. So the knee is actually tipping. So when you look at the knee joint here, it's actually tipping this direction, okay? And so when you see it tipping that direction, you get an impact and you start to develop friction in that joint space. And so that joint is now affecting the meniscus and the bone itself. The other thing you might notice is this purple thing here is the kneecap. And in this area, it perfectly sits over this patellar groove here. Well, the kneecap or patella has now become off-centered. And so it's starting to track funny. And so that usually happens because some muscle groups on this side become over-strengthened and some over here are weaker, which causes that to pull that patella off. Well, now we already have the knees bending this direction, right? So the femur's tilting this direction, so it's going to pull it even more. And so that's going to start to damage that articular cartilage, because when it gets out of this groove here, it starts to rub. And so when it does that, it's going to bend against the femur and start to break that up and tear it up. And so that's when those patients start to have that kind of pain that's like achy and sore all the time, you know. And this is the kind of pain they get when it hurts to walk or go up and down stairs. And so we're going to discuss some of the more common treatments for these conditions here in just a little bit, but that'll be in our next series. So tune in for the next series where we talk about some of the common treatments that are currently done for a knee in this condition, and find out whether you may be able to avoid yourself a knee replacement.